what is the Vivos Method again?
So it's a multi-integrated treatment modality to address the anatomy that rises or that causes sleep apnea, obstructive sleep apnea, and that is underdeveloped jaws. And so with children, we can actually help develop their jaws, which is what we've been doing with Healthy Start. But this is for adults and kids, but there is even more we have to offer with it as far as treatment planning and therapy options. And so I've been a patient for 8 months, and my overall treatment plan is going to be about 24 months.
Okay.
So we're just going to show you some changes in my upper arch. This was initially, and this is at 8 months.
Wow.
And that's interesting, but to me the thing that matters the most, and I haven't redone a sleep study yet, but what is most impressive to me, that just kind of shows, is
The airway.
airway. So this one is really just showing my cranial base.
Okay.
And this is the airway, or this is my palatal width. So my palate was originally 30 millimeters between the first molars at the bone level. So it's not at the tooth level, it's at the bone level.
Okay.
So it's up to 32 millimeters.
Wow. That's huge.
So here's my airway, and this is right behind my soft palate.
Okay.
And so there's a medial, lateral, and a lateral distance. Overall, it's about a 8% improvement.
Okay. Wow. And that's really hard for adults to make improvement. Kids can make it much quicker.
But this is behind the tongue, 25% improvement.
Wow.
Yep. This was before the tongue surgery also.
Okay.
This is what is the most impressive to me, is my nasal passages.
Wow.
So
Oh my goodness.
Essentially, it's a 50+% change.
Wow.
So the soft tissue here has, the inflammation's gone down, and some of that's from the breathing therapy that we will do with Vivos as well.
Okay.
But it's also, my palate has expanded, so that's widened the lateral borders of the nasal passages.
So ultimately, people with a lot of sinus issues too, this could benefit.
Oh yeah, upper airway resistance. So this is actually the posterior nasal aperture, and so that's about a 10% increase in airway volume, or ability to get air in and out the back of my nose. But here is the so what's interesting with this, and we set up the same way with x-rays, but there's always some discrepancy, but you don't see you see a double border of my mandible here.
Right.
Here you don't really notice that.
Wow.
Yeah.
It sounds like you're holding yourself different too.
Yes. And that's part of it. So overall the airway volumes increased about 21%.
Wow.
And so here is the actual lateral view of it.
Okay.
And the biggest expansion is the base of the tongue.
Okay.
And the soft palate is actually now attaching to my tongue properly, like it's supposed to. So that is something that I'm now able to have better tongue position.
Okay.
So I'm actually able to get my tongue up higher.
And this is post surgery?
This is before even the tongue surgery. This is just from the palatal expansion that I'm doing, which is, it's a biomimetic oral appliance therapy.
Okay.
So it's not really orthodontics, it's more orthopedics.
Yeah. That's what people are not understanding when I'm trying to explain it. It's like, it's not orthodontics.
And these are just my temporomandibular joints, and nothing really significant about that right now.
Okay.
So there was something else that I wanted to show you because of your Yeah, this is actually 3D printed my Airways. So that's
Wow.
Wait, let me see. Oh.
So this was June 2021, and this was March.
What
And
is
you can
the,
see
what are those
more.
things?
That's his throat, Joshy.
Yep.
And see how he has more room
so
in
it's
this one?
It's more like a big straw than as opposed to a little straw.
Yeah.
But they're this is something that we're going to work on too. Where it will probably require some body work
Okay.
to just get better spine and cervical spine posture.
Yeah, because you're gonna have to retrain the muscles.
Yep.
Yep. Yep.
So you may understand that one a lot more than I do. And this shows my facial symmetry or asymmetry. And the length from here, which this point doesn't move, and this is the mandible, so the mandible does move, but from here to there, it's 69 millimeters, and here it's 67, so it's a little off as far as, and so it's gone up a little bit. So it's kind of repositioning.
Yeah.
And the theory is that my glenoid fossa is remodeling also,
Right, which is
where the
this.
TMJ joint is.
Yeah, yeah.
And the zygoma is not really moving much, but this is going this way and that way, the maxilla, which is allowing my lower jaw to go forward where it needs to go.
Where it needs to go.
Yep.
Show us a picture again of your face.
Yeah.
I know you normally see
And it's the angle.
a change and
Yeah.
stuff like that too. Do you have a
Well,
side view of you?
Yeah, we're going to update these photos because
Okay.
the angle was different.
Right.
That's before my tongue
Wow.
surgery. But there is a side view.
Because I think I've seen, Sarah, hand me that book.
Yeah.
What's
So there,
okay. Go ahead.
this intracanthal angle, in theory, will change. So it'll become more V-shaped.
Wow.
There's the side view.
Yeah. So what I noticed too in the jaws
Yep.
thing is that now we're looking at these small jaws, right?
Yeah.
That is really the problem.
That's the whole problem.
Yeah, that's the whole problem.
Yep. And the biggest problem is that most people have them, so it seems normal.
Right.
But
Right.
These are just showing like the nostrils, and eventually, when I'm done, I want to see symmetry.
Symmetry. Yeah.
Yep. So
Very cool.
people ask me, do you feel like you can breathe better?
Okay, I'll do
Through my nose,
Sorry.
I do feel like I can breathe better, but that's very subjective. But the X-rays show that my nasal passages have enlarged, and
Yeah.
then my posterior airway is enlarged also.
Right.
So
Right.
we're on track.
Yay! Thank you, Doc.
Yeah, my pleasure.